Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula County Health Department's COVID-19 response. Today is Thursday, April 30th, and this is my daily briefing. We've had a total of 41 cases to date in Missoula County. 39 of those cases were identified by testing and 2 were epi-linked. We have had 40 recoveries and 1 death, and we have no active cases in isolation currently, but we do continue to follow our remaining close contacts. The state of Montana has had a total of 453 cases and has had 16 deaths. So we have 0 active cases right now, which is clearly something to celebrate. However, that doesn't mean that this outbreak is over or that it's time to change our behavior. We just ended the stay-at-home directive, which had a large part in stopping the spread of COVID-19, minimizing the contacts, and keeping our cases low. The 0 active cases is a sign that social distancing measures really worked. Still, we need to ensure that any cases that have not been identified in the community don't change as activity in our community increases. I just want people to remember that COVID-19 is challenging in a few ways. So first, people can spread the virus before they show symptoms, and people with mild cases may not recognize that they have it. This means that unsuspecting people could give the virus to someone and not realize that they're actually sick. Secondly, we're just now getting the resources to test as widely as we need to and have an expanded symptom list that captures the more mild cases of the disease. Again, this means that we could have people who don't realize that they have it. So if you have a fever, coughing, difficulty breathing, chills, sore throat, muscle aches, vomiting or diarrhea, again, coughing, difficulty breathing are really the most indicative ones, but some of those other symptoms could also potentially be COVID-19. So it's really important that if you have any of those symptoms, please call our hotline at 258-INFO, that's 258-4636, and get a test scheduled. Thirdly, the incubation period for COVID can be up to 2 weeks. This means that we could have people who were exposed and don't know it yet. So vigilance is still really important. Only after several incubation periods with no new cases can we really start considering that COVID has not continued to spread. Same thing when we look at phases of reopening, we will need to look at our numbers not just day by day, but in increments of the incubation period of 14 days. So the last thing that I want to talk about today is that later today we plan to release some epidemiological data on the cases that we've had in Missoula to date. So keep an eye out for that information on our website and also on our Facebook page. So my daily briefing was really short today. That's all I have for you. As always, you can subscribe on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so you get notified whenever new videos are uploaded. You can follow us on Facebook. As I just said, we'll be releasing some more information today on our epidemiological data on our cases. So you can find that on the Missoula City County Health Department's Facebook page. Check our website at missoula.co/cvirus. And as always, you can schedule a test if you are having any of those symptoms at 258-INFO, or you can call that information line if you just have other general questions about COVID-19 or are needing to connect with some resources. That's it for today, so everybody stay healthy, and I will talk to you again tomorrow.